want to bring on our next guest, a doctor who we've discussed this problem with for quite some time. Dr. Michael Saag, Associate Dean for Global Health at the University of Alabama at Birmingham, joins us now. And Dr. Saag, when we look at this, obviously it's worrisome on the trend lines that we've seen, but this is something that a lot of people had predicted could happen without strong social distancing measures. What's your take on what we're seeing play out now?
I think you're exactly right, Zach. This is what a lot of people predicted, including me. When I looked at this, we go back to the Labor Day weekend a little bit before everyone saw folks clustered together, kind of got nervous. Now we're starting to see a lot of those locations have an uptick in cases, and it is concerning. The good news maybe is New York City is coming down and the ERs are almost vacant. So it really is very geographically diverse.
Yeah, and when we talk about right now where we're seeing those cases as well, obviously Florida also having its issues. California's hospitalizations are at the highest since mid-May, rising in 9 of the past 10 days. But this is something that's not necessarily happening across the globe. When you look at some European nations seeing their case counts fall, New Zealand, we're struggling with this now after some of ours have not necessarily seen the same issue.
Right. I think it was how we collectively approached this. We were a little bit late to the game in terms of getting people to stay at home. Other countries were much more assertive, aggressive about that. New Zealand has had 0 cases for the last month. It's a small country, but still. Australia, 9 cases a day. Germany has less cases a day for the entire country than we have in the state of Alabama, with only 4 million people in the population. I'm not going to dwell on the past, though. That's not what's important. What's important is from now forward. We have to start thinking about what can we do. The thing that concerns me is not a place like Manhattan. It's a place like smaller communities in Texas, Alabama, Tennessee, Georgia, South Carolina, Florida. And the thing to watch, maybe even more than the cases per day, is, as you mentioned a second ago, the hospitalizations. Remember back to the beginning when we were worried about Manhattan overwhelming its healthcare system. I'm very concerned that a lot of the rural hospitals, smaller cities, are going to become overwhelmed, overrun with cases, and that's going to hurt healthcare in general for a lot of people in the country.
Yeah, how much more concerning does that become when we think about these super spreader events? A lot of people noting that protests around the country may.
Yeah, Doctor, sorry, I'm Heidi Chung. I'm going to jump in right here for Zach. But just to follow up on his question that he had just started, when we take a look at those super spreader events, protests across the country have come down a bit, but those are still occurring. So is that something that's on your radar right now as well?
It is, and maybe just like Memorial Day was for a lot of places, some of the protesters were wearing masks. They were keeping physical distance. I'm less worried about them, of course, but there were lots of big aggregation of people in a crowd with no mask, and a single person in a 10-foot radius around a lot of people can spread to whoever's in their immediate vicinity. So we'll be seeing that bump perhaps by July 1. But in the sort of big picture here, the smaller communities that didn't see many cases early on, those people suffered economically in a big way. And they looked around and said, where are the cases? So now that the things have been relaxed, they're going about life as it was before March. And the virus is still there, and the virus is spreading. And come August, we're going back to school, and we're going back to colleges, and we're doing everything we can to mitigate. But I'm really worried about going into the fall that we're going to see. We can call it a spike if you want. I would just call it a continuing rise. And the problem in the fall is that influenza season joins the party. And then we have a big problem trying to manage both.
And Doctor, earlier you mentioned that you're not exactly that worried about Manhattan, but density has been a concern for a lot of people. And so I'm curious, summers, people are going to go to the beaches, people are going to go to the parks. Do you not see a spike in cases perhaps sooner in Manhattan than the rest of the country?
It absolutely can happen. Your point is spot on. Density is what matters. You can almost think about it like you do in economics when you're doing probabilistic guesses about looking at an integral. So you have density as one of the factors, both in terms of how close people live together, how much they're in the same space, whether it's indoors or outdoors, whether they're wearing a mask or not, how long they're in that vicinity together, and you put all that into like a calculus equation, you come up with some likelihood of people getting infected. We're doing a lot of things in the wrong direction. New York had done well in May, and we're seeing the result of that. But you're right. They could fall right back into something, and they're tinderboxes in those large apartment complexes that could, just like nursing homes, have a big explosion of cases, and we need to keep our eye on that.
And Doctor, finally, I want to get your thoughts on the developments that we've gotten on the vaccine front. Moderna looking to start a big trial in July, and then we have Regeneron looking to start human trial as well. Do you think that these are some drugs that will actually be beneficial in the near term here?
Your guess is as good as mine or anybody else's at this point. What's good news, though, is that we have multiple shots on goal. You've heard a lot of people say that. The fact that we have more than one candidate, maybe we'll get a hit out of that. Maybe we'll get multiple hits. Great. But vaccine development is fraught with hazard. It's very risky. A lot of things can go wrong, even though they seem to be going right at the moment. And the best example I can give you is we've seen antibody responses, which is what we're looking for in those early studies. Great. And those antibodies neutralize, which means it can protect infection. Even better. But when you start giving it to large populations and they get exposed to the virus, the money is, did that antibody protect them from getting infected? We'll know that last quarter of this year, maybe first part of next year, but the cautionary note, sometimes antibodies like that enhance infection. And we aren't going to know that until we see the results of the study, meaning we actually may see more cases, ironically, in the vaccinated population. Only way to know is to do the study. Hopefully that won't happen, but we'll have to wait and see.
All right, Dr. Michael Saag, Associate Dean for Global Health at University of Alabama at Birmingham. Thank you again for joining us. Great insights today.
Thank you so much, Heidi.